So very good afternoon. We have Dr. Rajeev Kapur with us. Welcome, sir.
Thank you.
He's from Apollo Spectra and he specializes in aviation medicine and hospital management. Sir, I'm really feeling a very positive vibe sitting next to you. So I'm starting with my first question. Please shed some light upon the role of digitalization in the hospital setting.
Traditionally, the medical records used to be kept in paper form.
Right, sir.
And as the years pass, the medical records keep growing in size. A room is full, then a block is full, and then you don't know where to park the rest of them. So digital health record is a necessity, and it helps in proper storage of records, which can be retrieved as and when required. So it's very important for today's healthcare practice.
Right, sir. Electronic health records and the digital prescriptions that we are having right now. So, sir, coming on to this, one of the biggest challenge that we face in the hospital setting, I am also a hospital administrator, that the resistance to change. The issue is with the adoption. Being a senior doctor, being a very renowned hospital manager, what do you think are the other challenges that we face with the adoption of the digital health and how to go about them?
I think the most important factor is that many doctors were not familiar with the electronic devices. They were working in the manner they had been taught. They would write prescription. Prescription writing was an art, and so they were very comfortable doing it on paper with pen. Digital devices are comparatively new. Of course, today's younger doctors, they are all familiar with these devices, so they won't have any problem. It's older people of my age, some of them are not very comfortable with devices. So if they are given time to learn how to use them, I think they would be willing. And as it was mentioned by one of the speakers today, that a doctor who had all the electronic medical record which could be retrieved when relatives of some patient wanted to fight with him, he was able to show them what the facts are and not the facts that were told to them by somebody else. So it's very important to retrieve information and give a better quality of care to the patients.
Right, sir. So, sir, what are the recent advancements in this context of digitalization in the healthcare hospitals that you suggest hospital should start implementing?
I think it's very important to integrate all the functions of the hospital in one system. Many times people say that we'll have a computer at the reception and we will have a computer in the account section. Sometimes they would have in the medical stores or dispensary or whatever they call it. The question is, if all the processes in the hospital are integrated in one system, one management system, then only it will be a success. That means you should have all the doctors and all the important functions of the hospital linked to one hospital management system.
Right, sir.
And many products are available in the market today. Only thing is you have to find the optimal product which is useful for your.
Right, sir. So, sir, these days the concept of digital ICU is getting famous. Doctor monitoring his patients via AI and the cameras. Sir, what are your comments about it? That don't you think the physical touch is very important? The face-to-face interaction is very important.
Definitely. There is no substitute for physical presence of a doctor and the patient in the same room. And touch is one of the most important factors of healing.
Right, sir.
When a person takes pulse, that's how we were taught, that when you're taking the pulse of a patient, you are not only trying to find out his heart rate, but you are also trying to reassure that patient. If your touch is harsh when you're taking the pulse, it will repel the patient.
Right, sir.
If it is soft, caring, the patient feels that, senses that, and that is where the rapport builds. But in the ICUs, when you have large number of patients, a very limited number of doctors and nursing staff, the digital processes help you monitor them better. Like you have various monitors which are monitoring various parameters which are connected to each patient. Now, at one time, one person cannot see 16 monitors.
Right, sir.
So he need to see only those where the alarm is going up. That means two guys are having some unusual parameter, oxygen saturation going down, heart rate is going up, a person has an arrhythmia. So the attention is focused on that person who is having a greater problem. So it helps. But definitely, doctors
That is very important.
touch is
Right,
that
sir.
there cannot be substitute to that.
Right, sir. So this digitalization, this EMR, everything is simplifying the life of the clinicians, of the patients, of the administrators, right, sir? So, sir, what will be the
In some ways,
in
yes.
some ways, of course. So, what do you think will be the future of employment? Like, since this digitalization is simplifying things, you can do things at a much lower cost with less manpower. So, what will happen with the future of employment?
In India, I don't think anybody fear unemployment in future because the population is such, and what we lack was the resources. We could not build so many hospitals, we could not buy so many equipment. Today we can buy everything. There funds are available, and awareness is there that you have to have decentralized healthcare facility. That means in the primary healthcare center, in the tier 2 cities, you should have good healthcare centers. They may not be tertiary care, but reasonably well equipped hospitals should be there. So there is a need to increase, and the government is probably focusing on that by increasing the number of medical colleges, increasing the number of vacancies for the teachers, so that more people can be trained. And we are not a country like USA or something, where the population is small and resources are huge. So their unemployment is definitely a factor when computerization happens, digitalization happens. But in a country like ours, it is only going to facilitate the spread of healthcare to different corners of the different strata of the society.
So, being too much dependent on the technology, on the computers, of the internet, do you think is it the right thing? Like, we may get the power cut. Our
Yes.
data privacy is also a question there.
So those are the challenges which we have to meet.
Right.
We have to find solutions, and there are solutions for power cuts. People have backup, people have devices which have batteries, equipment. Like I remember when I was in the Air Force, in a remote area, we were given a suction apparatus which would run only on electricity. So what happened when the electricity went in? It was a very common occurrence. By the time the backup comes online, and and backup always had a limited time. So then we searched around and found that there are battery operated devices available. So those could be used. And even when battery could not be used, there were devices available that time. Foot operated suction. So that's a life saving thing. Just like you have a paddle, somebody keeps paddling and suction is created.
Right, sir.
So there are solutions that can be found, and definitely data privacy is a very major challenge today. We have to be aware, and we have to find means of preventing the data from being leaked.
Sir, our viewers are the clinicians, the administrators. So, any suggestion you want to give them?
Don't fear technology, learn it, adapt it, use it as an aid in your clinical practice. Thank you.
Thank you so much for the conversation, sir. Thank you so much.